So I have a question for you guys.
What's up?
What is your question?
Have you guys heard that some doctors do unnecessary procedures?
Uh,
Unnecessary how?
yeah.
Well, the other day I was scrolling through TikTok, as I normally do, and I came across this one TikTok that was talking about how some doctors that do the breast implants, actually, some of them, what they do is when you ask for a specific size, they'll sometimes go a size or two bigger than what you've asked.
Why?
That sounds
What?
that sounds a bit invasive.
Yeah.
Yeah.
Yeah, when I heard this, I didn't understand why either, but continue to go and talk about how a lot of the times what happens is whoever goes to get these implants, they tend to go small, and then later down the line, they'll go back to get bigger. So some of the doctors say in order to prevent that, they just decide themselves, we'll just go bigger.
And so,
And they don't even tell them and they just charge you for that? Like a regular
Yeah,
amount?
they yeah, there's been cases where whoever goes under and wakes up later, like they wake up to something bigger than what they've asked for. Like this is apparently it's common. It's weird, but
That's
common,
fucked up. Because especially like if it's
right?
someone like they're not comfortable with a big chest and they don't want a big chest for whatever reason, and like all of a sudden they found themselves with a very big chest, and because then now it's like, oh well, now they have to do another procedure to get it down.
It's kind of funny because reminded me right away of an episode in the show Roseanne, and it was like she was having a dream because she has to go and get a breast reduction done because her back she's been having issues with her back. So
mhm.
she goes to get this procedure. But in this lucid dream she has, she wakes up and when she goes checks on herself, her boobs are bigger. And she's like freaking out. She's like, they're supposed to make them smaller, not bigger. And of course her husband's like, no, 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 this is better. Like this is fine. And it
Yeah.
like back then, like I thought it was just like a skit, Like I just thought like it was something for the laughs, for the lols. But after I heard this, I was like, oh my God, like has this been going on? Is this
Mhm.
something that like has been happening?
Right.
Nah, yeah.
Well, okay, so what did they said why that because women tend to go back and make them get them bigger?
Yeah, so it kind of becomes like a recurring thing where they'll start off small and then throughout the years they'll gradually get a little bit bigger until they get to the size that they want. Or at least some go back and do this.
You know what's
But
funny? I do remember like how not exactly that, but like oh, is it me and Em watched a TV show with these two doctors, plastic surgeons, and like they said they actually did talk about like breast size because like I think they said the reason that they start off small, at least for them they do. They said like because like again someone asked for something big right away and they're not used to that, like especially like how they say like oh the weight's different. Like what a lot of times they do, they said we'll convince them to go smaller, and if they still want it bigger, then they'll go okay another size or cup bigger, and like if they still want to go bigger, like okay yeah they'll work their way up to that size. And they said most of the time like they'll actually stop not exactly at the size but more smaller because they realize like oh this actually is much more better, it's perfect.
Hmm.
mhm.
So hearing that like they're like oh we'll just go bigger right away, it's like no, because it's true like if they're not, again like if it's like someone like with okay it's like an A cup and they want to go B or C and they're like okay no let's just maybe put them in a C or D, like that's weight they're not used to on their chest immediately. And not only that, but it's like I can also imagine it's like all of a sudden like you're told to carry, let's say you got used to carrying something like 5 or 10 pounds, and all of a sudden you're given like 30 to 40 pounds just automatically. I could see like how someone would struggle with that right away and be like, what the fuck, right? Like this is not what I was
Mhm.
told I'm gonna get.
Gosh. To me, I think that, well, first of all, I think it needs to be said, we are not medical professionals.
Yes.
So don't come at us. This is just,
Our opinion. That's it.
our opinion. Yeah, it's our own personal opinion. But, how scary, right? Because I feel that as a society, I think all over the world at this point, doctors are held at higher standards, right?
Mm-hmm.
I mean, you think of a doctor and you right away think, it's a professional and they're gonna do what's best for us.
Hmm.
They take that oath, but so we trust our doctors. It doesn't matter if it's a small procedure, a big procedure, if
Hmm.
you're just going in for a cough, like you go in there and, typically we trust our doctors because they know best. But it's scary to think, like in this case, I mean, okay, we're talking about something cosmetic, such as a boob job,
Hmm.
but a lot of people don't do them just for cosmetic reasons, and even that shouldn't even be like, who cares? But just, I'm shocked that they would just take it upon themselves. And, some doctors would do that. Like, I
Yeah.
don't, if it's for something, obviously, if you have to do like a last minute medical decision, I get that. But that's not
Mhm.
what the case. We're not talking about those. We're
No.
talking about, some doctors that will, oh, well, she's going to come back in a year or two to get them bigger. I'm just going to make them bigger now.
Hmm.
Hmm.
And that's what like baffles my mind because you don't know what issues this person might have. Like I reference about Roseanne, like she went in there to get it redone, but it was because of her back. Like a lot of people don't realize that having a big chest cause, can actually cause you back pain, can
Yeah.
cause you back problems.
Mhm.
So the fact that some doctors are over here thinking, oh, well, they'll just come back, like, you don't know that.
Right.
For all you know, they just gave this person back issues until
Yeah.
they come back to get it redone. Like, I don't know. Like, and then it's one of those, I don't know. Like, I think it's wrong because it's, if I'm going in there and asking for something specific, I'm expecting him to get that specific thing, not something bigger.
Right.
Don't make sense.
Well, yeah, because it could work. I mean, we don't know if it happens the other way around, right? Like if I'm gonna go in to get a breast reduction, but like, will they go smaller, or will they not reduce it as much? I think that's the problem, right? When they start playing God, I guess, and which I'm gonna be wrong. I think that in that profession, I'm pretty sure. Like I think we've all heard horror stories. I just saw one today about, this doctor who was an anesthesiologist, and he would be there assisting when the women would go in for a C-section.
Hmm.
And I don't know if you guys have ever seen how those procedures are done, but usually they flank like a blanket, on the mom's like chest, kind of to like prevent her view from it, because normally these women, normally you're awake
Yeah.
when the
Right.
C-section is being performed, but there's a sheet so she can't see. And so this anesthesiologist, oh my god, I just butchered that word, but 32-year-old man, and he was overly sedating these women, and while they were performing the C-section, because he was behind the little curtain just with her, because that's what I don't know if you guys remember, if you guys have ever had any surgeries or anything, like usually that oh my god, I can't say, that doctor is usually like right next to your head.
Yeah.
And so he was there, and while they were performing the C-section, he would unzip his pants,
Oh
put
my God.
something in the patient's mouth. Yeah. So,
Ew, what the
if you
hell?
know what I mean. Yes,
That is
yes.
disturbing.
And it wasn't until some of the nurses were like, that's weird, like these because normally you're not supposed to be that sedated, but they were noticing that they were being overly sedated. And so eventually they figured it out. They found out, and this man's in jail now.
Good.
But
Yeah.
No,
like,
yeah, that
how
is.
scary.
Oh my god.
Yeah. And people in the comments were saying, "What? Like, how did he even get away with it? Like, where there's other people in the room."
Real.
But I think it's that. I think it's because we, as a society in general, we do regard doctors. We place them in a higher standard,
Hmm.
and we forget that they're human as well. And while there are some really good doctors out there, and I don't want to think that, I want to think that most doctors are good.
Mm-hmm.
But that you're just unlocking doing this research. You just unlocked a new fear in me. So thank you, Noodles, for that.
So sorry. One thing about me is like I'm a scaredy cat about everything.
So
One, I
you're like,
fear
I must share it with everybody so
so
they feel it with me.
yeah. I'm like I fear a lot of things, but I still do my thing, you know.
Yeah.
No, yeah.
Anyway, did you guys? I know this was one thing that I heard that like terrified me and basically traumatized me when I heard. And I don't know if you guys have heard. It's called a husband slit or stitch. My bad.
Oh God.
A husband
Husband
stitch?
stitch. Yes.
What is
So
that?
So what? Oh God, hopefully I describe it well. But basically, what a husband stitch is when a woman gives birth to their child, and then afterwards, sometimes when they give birth, they get a little bit of tearing down there.
Mm-hmm.
So doctors have to go back and suture them up. However, some doctors stitch a little bit more than what they're supposed to,
Mm.
so that they're tighter for their husband. And this is called the husband stitch. And
Mm.
there has been, yeah, I remember hearing about this and I was like, oh my God, like that's terrifying because there was, I believe, one case where a wife gave birth, had to get stitched up. She went home, but like I think a week passed and she was in so much pain and she didn't know why. And when she went to go get checked, they ended up saying that the doctor who stitched her up completely closed her off. Like,
Oh God.
yeah, like it was it was really bad. And I remember when I read that, oh my God, like I was shaking with rage and just ugh,
Mm.
I felt violated for her. Like it's something that happens more often than we know.
Hmm.
Yeah, I think
That.
it's funny because like I think I kind of heard about that, but I don't think that there's the name for it. I think that I only heard it being said to used twice, the whole closing it up thing, because like I remember for two of the cases that I've heard, one of them because like she had a very like I wouldn't say traumatic birth, but like a very rough one. That to the point that the doctor said like every time she would sit up or anything, like her uterus would be coming close to like almost falling out. So he said, like he explained to like the husband and wife saying like I have to close you up so to make sure it doesn't fall. So this way it heals hopefully properly enough to stay back in its place. And another time I think kind of similar, but like when her baby was born, like her uterus like was literally coming out with the baby, so like they had to do like an
Oh
emergency like that.
God.
Yeah, I think those are the only two major cases that I've heard that they've literally had to close them up, and I think they actually had them stay in the hospital much longer, just to make sure like it's healing properly and that everything's fine, and then yeah, they said they'll undo it and then they'll send them home. But like for that to happen, like a doctor be like, oh, like for the wife to still needs to satisfy the husband, I'm gonna do this as a favor. It's like, first of all, that is none of your goddamn business. That is between them. And second of all,
Right.
it's like, oh my God, him closing her up. Like I've heard like unless it's like again like the two examples that I gave, like it's absolutely necessary. Most of the time they say they encourage them to be left open because way they could still, and this is gonna sound disgusting. I apologize for this already, but it's for like the whole like the bleeding still, the discharges, like it has to exit out of the body. Like if it's
Yeah.
kept in like that, it could cause infection, diseases, even in some rare extreme cases, death.
Yeah.
So the fact that he did that is like you were literally asking her to die.
Well, we go into the. I mean, I don't know. I guess we would need to look up the statistics of this, right? Like, were these more male doctors that were doing it, or have female doctors done it too? But it's kind of like the woman's idea, not ideas. Like the woman's health isn't taken into account. It's always about you just said, Masika, like, oh, pleasing your man, or it's none of their business. One about that, but it's now you are totally disregarding the woman's health, the woman's opinion,
Mm-hmm.
because why don't you talk about this before, right?
Yes.
So like when you're there in front of the doctor, I feel like that's something that the doctor could bring up, and then you can make as a woman, as the mother, as the one that's about to give birth, you should be able to say, huh, okay, yes, go ahead, doctor, and do that procedure. Or no, I mean, but the fact that not even that, they're not even taking the time to give us that choice,
Yeah.
Do tears happen? Do they sometimes? Because I was gonna say, when I had you, Musica, and this is another thing, right? I don't know if things have changed now, but I know that the doctors, when you go to when you start when you get pregnant and you start going to the obstetrician, they don't really explain anything. At least they did it to me. And I feel that most women that I've spoken to about this, that we've ever talked about pregnancy and giving birth, I don't think this happens either. But they don't sit there and they don't tell you what is going to happen to you. Like, they don't tell you what labor is going to be like. Everything that you know is either you self-learn it, you go and you do your research, or movies and shows, really.
Mhm.
So when I had you, the doctor did tell me, like, oh, by the way, we had to put some stitches down there because, that I got a tear, a small tear. Turns out that is a little bit normal. Like, that is something
Yeah.
that is normal.
That is something that
Women,
happens.
yes, that does happen. Sometimes there is something they can do to prevent that, and they go ahead and they cut you a little bit. And sometimes, like in my case, it just, they didn't do that, and you tore me up, Musica. And the doctor told me, like, oh, we
Sorry.
put, we put, some sutures, and I was like, oh, okay. I didn't even know. I mean, by the way, I mean, I was pretty young, so, but I didn't even know that was a thing. Like, that freaked me out.
Hmm.
So they do need, like, that there are cases where they do need to put, a couple of sutures, but that's not what we're talking about, right? Like, we're not talking
Yeah, no.
about that.
Yeah,
It's
like
now,
it's normal for some to get stitched down there because you do tear. Sometimes you do.
hmm
That's normal. That's something that does happen.
Mhm.
But what I'm talking about is that some doctors are taking the extra step to stitch more than what needs to be.
right, to help out the husband,
Yeah,
basically, or the
so
partner,
yeah, exactly. For the
for
husband
their
to
pleasure.
feel more pleasure. Yeah, exactly. And I don't know, like I'm over here thinking about like, oh my God, this poor like
These poor women, yeah.
yeah, are those stitches like getting like popped open or something? Like I I don't know. Like it just seems like that would be a painful process to go through or to be in.
And then, and again, and for what?
Exactly.
For someone else's pleasure, not even your own pleasure, but for
Yeah.
someone else's pleasure. Like,
Yeah. Like you get no say, they don't tell you anything. They just do it. They don't tell you that they've done it. They just do it. That's the scarier part is that like how many women are out there right now that had this procedure done and don't even know.
right. Yeah. That right there is my next question. Because we're only talking about the women that found out.
Yeah.
Mhm.
But they tell us your body changes once you give birth. So a
Mhm.
lot of the things, but we don't now it again, I don't know if now it's different also because of the internet. Now we have all these platforms where we can actually go and talk to other women and see, hey, are you going through this too? So I'm hoping that it's easier now a little bit, but it's still like something you don't want to talk about stuff like that. Like if
Yeah.
something is different, you're not gonna talk about it. But because we're so conditioned to like, well, your body changes, blah blah blah. And by the way, our bodies are wonderful, right? They are so freaking, they're magical because I don't know why it's in people's heads like, oh, once you have a baby, because yes, I mean, you are literally, transforming your body and getting something the size of watermelon out of a very small hole. So yes, that is, I can understand why people would be like, I know this might sound crude, but like, oh, it's not going to be tight anymore. But guess what? Our bodies do go back. They
Mhm.
do. I mean, ask a doctor, like, would there be some changes? Probably, but it's not going to be, it's more we feel it as women. I'm not even talking about just like down there. It's more something that other people wouldn't even notice.
Mm-hmm.
Maybe your temperature. I know that me, before I got pregnant the first time, the weather didn't really bother me. Like the heat, I was one of those people that would sleep under covers in like 100-degree weather. But after I had Musica, I mean, after that, forget it. Like the heat would bother me. So it's things like that I'm talking about. But as far as like the anatomy down there, I mean, like our bodies really do bounce back. They
Mm.
really.
Mm-hmm.
So for men to think, oh no, it's not, that's coming from a place of ignorance. And then they're doctors of all things. They're doctors. Like what?
I think
Ugh,
that's the scarier part. It's like we said it earlier. It's like you go to this doctor and you have to put all your faith that they're
they know what they're
doing,
doing.
that they know what they're doing, and that they're doing what you're asking them to do, nothing extra, nothing more. But nowadays, you really don't know. Like, just like with all these procedures that we're giving examples of, like, I don't think the ones who go under thought, oh, my doctor might give me bigger implants. Oh, my doctor might stitcher me up more than needs to be. Like, I don't, like, I have gone to the doctor, I've gone under before, and I've never, like, my thoughts, because I am me and I have intrusive thoughts, like, I do, I did worry about, like, oh my God, they can do anything to me and I'm not gonna know.
Right.
But I have to put my faith that they won't, or that they haven't.
No, yeah.
I I think before for me, I used to go in trusting 100% blindly. I
Hmm.
never used to have those thoughts, but now I do.
Yeah, wait.
um, yeah, no, it wasn't even this, but I think that started maybe about 15 years ago. So I remember that, yeah, growing up, being a teenager up until, probably all of my 20s, I blindly trusted doctors.
Hmm.
And so it wasn't until really fairly recent, if you really think about it, that I started having those thoughts. So,
Hmm.
yeah.
That's
Oh, well
crazy.
then
I
the
thought the
next thing I
same
have to
things.
say probably won't be any better.
Oh no.
Oh gosh, I'm
So
ready.
talking about doctors doing unnecessary procedures, a doctor recently in Virginia, I don't know his name, they haven't put it out yet. He's serving now, well, he's currently serving now, 59 years in prison, in federal prison for doing unnecessary procedures of hysterectomies towards women.
Oh
Oh
my
my
God.
God.
No, yeah, like, and they say some other stuff too, but like that was like the most major one. Like, he'll give off reasons why he did it, why they should get it, and they said sometimes he would even do like little extra stuff too. But no, yeah, like he would purposely like stop families from wanting to become families.
Did
We're
he? Oh, sorry.
No, go ahead. Ask your question.
I was gonna say, so did he do these procedures without telling the women? And then like once they woke up, he would tell them like, "Oh, well, we had to do this," or was
And
it he would have meetings with them and then kind of just be like, "This is the best thing for you to do."
both, to be honest, it said like in some cases like he would tell them after, saying like, oh, like this complication happened, this like it happened unexpectedly, we had to act fast, and now like I did hysterectomy on you and you can no longer have kids. Others like he would convince them from a minor thing, and because again like 'cause most of the time like we don't know what we have, and then they immediately told right there, and like he's trying to guide them to this other procedure because like it's more bigger, it's more invasive, it's more expensive, and for him like pretty much for him it was just plain greed. Like he was like, I just want the bigger surgery so I could get paid more.
Oh.
Yeah, they charged him for over 20 million, and 2 million of his assets were seized.
So I was gonna say that actually this goes a little bit about, this is kind of the research that I did when we were going to talk about this topic, when I found out that we were doing this topic. And it kind of ties into what you're saying, Musika, because I found this doctor on TikTok, Siler S. Flyer MD. And somebody asked her if doctors perform unnecessary procedures? And so she asked that question, and then she goes on and replies, and she says, and it was specifically American, because it was asked, like, do American doctors make unnecessary procedures? And so she said yes. She said yes, and the reasons are, the number one reason is because of money. And that reminded me, I've seen articles about doctors that C-sections went up. They were going up rather than natural births, because they were trying to figure out what's going on, and it was because the doctors, they make more money. They would make more money doing C-sections than just like a natural birth. So, again, we go back to, ties into this. They go in and they're doing this, not taking into regard their patient's health. And they were doing these C-sections just so they can make more money. And so this is something that is known. It's not a secret. And with the way the insurances are, and again, I'm talking about here in the US. I don't know how it is everywhere else.
Mm-hmm.
But yeah, you're right. It's because of money. So I'm pretty sure this doctor was doing all these hysterectomies. And then, afterwards, because you really needed it. We're just trusting blindly because we don't know.
Yeah.
But at the end of the day, it's because of money.
Honestly, no, yeah, I can tell you, like, now, like, not only because of, like, of any other surgeons or anything, like, I'll either look it up or, like, I'll be like, is there any way I could get a second opinion on things? Like, especially with surgeries like that, whether it's minor or major, like, I would definitely ask. Because it's good to ask, to get different opinions, because, like, what one doctor tells you, another might be like, no, that's not the reason why. And, again, like, also not saying, like, oh, like, do your own research, because, like, it could also get jumbled up, too. But I'm saying, like, do your, not discouraging either, like, yes, like, do your own research, too. Or, like, again, like, ask different platforms of people who've gone through this and be like, hey, like, I've been told I might need this or that, and I'm having, like, this kind of, and maybe it's because of this and that. Then you're like, oh, because I'm tired, or, like, I have a sore or something like that. And, like, has anyone else gone through this? And, like, what's been your experience and stuff like that? And who knows, like, your answers might be different. It might be overwhelming. It might not be what you've been told.
I think, and it sucks because it shouldn't have to be this way.
Mm-hmm.
But remember and we're going to have to do a discussion about this, what I'm about to talk about. I'm just going to bring it up really quick. But this reminds me a little bit of the story that you first brought to our attention, Noodles, the one with the firefighter that confessed to unaliving, letting people die because of their color, of their skin color. And I think that opened up a lot of people into, like, whoa, I had never even thought about that for firefighters. But it's like, because we forget, we've always regarded them as, they're in this noble profession. They're in, why are you going to be in a profession that is meant to save lives and not do that? Like, why go into that? And it's the same thing with doctors. Like, now I think that opened me up to thinking, it's not just firefighters. And again, I'm not saying all of them are, no. But it's like everything, right? With just one rotten apple, that's all it takes.
Yeah, because then now it's like, again, it's like with anything, like, whether it's, like, cops, doctors, nurses, firefighters, like, people in, like, professions of, like, meaning to, like, serve and protect, and help heal the people. It's like, when you hear, like, one bad thing from them, it's like, oh, like, it makes you question, like, how many more are out there? How many have done this? Because now you'll never look at it the same way again. And I know some people get upset about that. It's like, oh, like, I would like it better. It's like, no, because, like, you can still bury your head and understand it all you want, but that doesn't excuse the fact that, like, this is still happening. And you never know. It might happen to you, might happen to someone that you know, might someone that you love. It's good to let someone know. This way they know to be extra cautious. I mean, it's sad that it has to be that way, but it's, like, better to protect yourself rather than get a bill to overpay for something that you never wanted, you never asked, you were never given the option to.
Right. Mm-hmm. Well, and then the thing is, too, again, here in the U.S., first of all, most people that are going to get any type of procedure, you're going to do it because you have insurance. Second of all, most of the times when you have insurance, health insurance, you don't really even get a bill. So you don't even know what is getting billed at the end of the day. So again, we go in there blindly. So, and I think it's harder for people of color, because it's women. Unfortunately, let's say what it is. It's because it's most of the time it's the male doctors thinking that they know more, and they do these unnecessary procedures to women. Again, it goes all the way from cosmetic, like giving you bigger boobs when you didn't even ask for it, to life-saving stuff, to stuff like that, like with the C-sections, or giving you the husband slip, So now it's like, okay, because you're a woman and the doctor knows what, okay. But then it's also, again, and then going back to the thing with the firefighter, I mean, I'm sure that there's doctors that, again, because we need to realize that, we're all humans. We can't put these people on pedestals, especially after all the things that has come out. And so, and again, there are good doctors out there. There are very good, and it's unfortunate because of things like this, of the few rotten apples.
It's one of those, like, I guess it's just, you have to do a deep dive into your research whenever you go to whoever. Because at the end of the day, like, for me, like, I have my local doctor that I go to, but I really haven't done any research. But I go because, again, like, the blindly following and believing that, my doctor is doing what's best for me. But a lot of the time, like, I think if you ever have to go through any procedure or anything, you should look into that doctor who's doing through the procedure. You should look into, like, what do others have to say, if his ratings are good, or, like, all of that. But, yeah, I think that's the only thing you can really do at this point to try and keep yourself safe.
And speak up. Speak up, because a lot of the time, most of the time, I will say, we don't speak up. We don't share our bad experiences because we think that it's only us, or, for whatever reason. But I feel like this helps, us reading those stories, because it'll just, you go in there more informed, you're more aware, and that's important to stop these things from happening.
I agree.
No, yeah.
But I don't know. You gave me a lot to think about, Noodles. And I don't know if I appreciate that. No, just kidding.
It's a little taste of the intrusive thoughts that I have, so you're welcome.
Well, thank you. Like I said, thank you, because I feel like with this, we need to be more aware and do more research. And not just go by what the insurances say, because that's another problem. I feel like if your insurance only covers this one doctor and there's nowhere else, no other doctor you can go to, and you maybe are not, this doctor maybe might not have the best track record or whatever, but a lot of the times we're kind of forced to use that doctor. And those are things that we need to work to change as well, because the insurances should not be able to dictate on who we go with because of this situation.
Yeah, I agree with that. It's still shitty that, at least here in the US, like, healthcare isn't free. Like, it should be at this point, because we already have so many health issues. Why not help us? Why make it so hard for us to even get seen by anyone?
Yeah.
Doesn't make sense.
No, yeah, I agree. Especially it's like, it's like, oh, it's for the young future, and like, okay, but like, how can you say it's for the young future if, like, it's so hard for them to even get a simple checkup?
Our priorities needs to be set straight, like, honestly. At this point, it's nothing but for the money grab.
Yeah.
That's all it is at this point. I've heard that in some hospitals now here in the US, I don't know exactly where, but instead of being called patients, we're being called clients.
Wow.
So that's just to show you how bad it's gotten here.
Yeah, that's sad and scary.
No, yeah, because then it's like, oh, clients, like, that's like, again, sounds like any other place, like a restaurant, a store, and it's like, okay, then it just brings up the whole, like, whoever has the most influence or, like, the more money to flash to be, like, seen first, then, or take top priority.
Well, but then also that's a a double-edged sword because I mean, look at what happens to stars like Matthew Perry. He has the money, so but he was still wronged by the medical community.
Mm-hmm. Well, yeah, because they all,
So
because we go back, he was just a client. He was giving
yeah,
them the money that they wanted, and they were saying, "Okay, here you go." Like, it's just.
it's money. It goes back to money.
Mm-hmm.
Well, thank you, ladies, because I always enjoy having these type of conversations with you guys because it always takes us to different to a different pathway of what we think it's gonna, we start up with, but
Mhm.
that's good, and I love that. So thank you
Yeah.
very much. And I want to say thank you to everyone for watching. And if you like this type of content, we do different subjects. We are starting a new series. If you guys want to check that out, um, about it's the sitcom effect. But yeah, if you guys like what you guys are listening to, don't forget to like, subscribe, share. But thank you for joining us. I am Mita, and I'm here with my co-host Masika and Noodles, and
Bye.
we're bluntly
Bye.
talking. All right,
See you
bye.
later.